So this session, what we're going to do is look into burns and scalds. So what causes burns and scalds? Various things, hot water, liquids, anything like that. So it's just basic first aid in burns and scalds. So if you can think about scald, S-C-A-L-D, scald. Use it as an acronym. Basically, what does the S stand for? The size. So how does a first aider measure the size of a burn or a scald? Simple. All you do is look at the patient's hand. Not your hand, the patient's hand. Look and draw an imaginary line round the outside of the hand, and that represents 1%. So it's just a rough guide to give you a rough idea of what percentage of burns. So the size, 1%, their hand. What do you think the C stands for? Cause. What has caused the burn? So they need to know what's caused the burn. A stands for age. They need to know the age of the person. Who's more susceptible to possibly life-threatening conditions? A baby with 10% burns or you with 10% burns. So it's important they know the age of the person. The next acronym L stands for location of the burn. So where on the body? Head, face, chest. They need to know where on the body the location of the burn or scald. The last one is what they call the depth of the burn. So if there's a burn or scald on my arm, there's 3 sizes. Forget first, second, third degree burn. They now say when damage to the skin on the outer side, that is classed as superficial. So what would you say with a superficial burn? Slight reddening of the skin. It'll still be painful. We'll come on to treatment in a minute. So that's damage to the outer layer of the skin, the epidermis. As you go a bit deeper, it damages the epidermis and the dermis. That's what they call partial or intermediate thickness. So what would you say with partial intermediate thickness burns? Blisters. So what do you not do with blisters? You certainly don't pop them. You don't put any portions on, anything like that. So underneath that blister is the liquid part of the blood called plasma. So don't burst any blisters because they have lost blood. So somebody with 60-70% blisters all over the body, they've lost blood, the clear liquid, the plasma, they're going to go into shock. So it's important that you recognize signs and symptoms that they're going into shock. As you go further down through the skin, the epidermis and the dermis, you then come to the subcutaneous fat or the muscle. Now in the muscle, there's nerve endings. So the last depth on the burn or scald is what we call a full thickness burn. Any full thickness burn must go to hospital. It doesn't matter whether it's 1% or above, they must go to hospital with a full thickness burn. They won't feel any pain because the nerve endings will be burnt. They will later on, but at the time they won't feel pain. So it's important any full thickness burn must go to hospital. Now 1% and above, you've got to make the judgment whether they go to hospital. But don't be frightened to know the knowledge you've got, the signs and the symptoms. If they're going into shock, they could have a cardiac arrest. So don't be frightened, to err on the side of caution. If you're not sure, seek medical advice, 111, and again, if it's life-threatening, ring 999. What we're now going to discuss is your treatment for burns. So how would you treat burns? The first thing that you do, you cool it under running water for 20 minutes. So some of you will have done for 10 minutes before. 20 minutes, that's what they recommend. 20 minutes under cool running water. Now the problem with any burn or scald is infection. Now you did the bandaging previously, that will stop infection, but you cannot put a bandage on a burn or a scald. So what can you use on a burn or a scald? You can use cling film. It's cheap, effective, and it stops infection. So all you've got to do is roll your cling film out, discard the first 6 inches, roll it out, place it diagonally, tear it off and wrap it loosely round. Do not pull it tight, wrap it loosely round, but it's still burning under the cling film, so don't be frightened to still put cold water on it even when you've got the cling film on. Some of you may have proper gel dressing burns, but remember that area will be hot, the gel will set with the heat, so you still have to pour water even onto gel dressings. Other types of burns or scalds, remember electricity will cause burns and scalds. The most important thing is remove the cause of the electricity. Look for danger. We've all done it where somebody's leaning over to pull a plug out and they get a shock. They're lying over a table, you're tempted to rush in. Remember, think danger. Remove the cause of the problem, then response airway breathing. Chemical burns, make sure you've got PPE equipment on. Brush as much as dry powder off as you can and don't take any chances. So use your PPE equipment. Remember, with burns, 20 minutes cooling and then cling film.